Well, let's bring you the very latest on this story. We can take you live to Brussels. France 24's Dave Keating is standing by there for us. Dave, firstly, talk us through why health ministers from those 6 countries that were cited, why are they so concerned?
Well, they're so concerned because this is effectively the only vaccine that the EU is working with at the moment. Pfizer was the first one approved. The EU just approved the Moderna vaccine last week, but they're still going to take some time until that's going to be available. And also, the production capacity for the Moderna vaccine is limited. So really, the EU is very, very dependent on the Pfizer vaccine right now, as are most countries, because that was the first one they all approved first. This announcement by Pfizer this morning took people by surprise. They essentially had good news and bad news. The good news was they have a solution to the production bottlenecks that have been seen so far. The bad news is the solution is that they have to revamp their production facility here in Belgium, and that's going to take some things offline the next couple of weeks, and that's going to mean they can't deliver all of the orders that they were supposed to in the next couple of weeks. But they told Commission President Ursula von der Leyen, as she was explaining there, that they will still meet their obligations by the end of the first quarter, that is by mid-March. So the expectation would be that they would majorly scale up after late February, after this period of a couple weeks where the deliveries aren't being fully delivered. But in the short term, that's very worrying for member states. There have been all kinds of problems in the rollout of vaccines in the EU, and that this could slow things down further. This slowdown of the delivery of the vaccines actually doesn't just affect the EU. It affects all countries outside of the US. So the UK will also see vaccine deliveries fall off in the next couple of weeks. Also Canada, the minister there was saying that she's been notified the delivery to Canada will also be affected. So the numbers that they're sharing here in terms of the change of delivery, what will not be delivered, are not huge, but it could still cause a big ripple effect and really affect these countries as they're trying to roll out their vaccinations right now.
I mean, Dave, talk to us a little bit about the other vaccine options that are available, if you will.
Yeah, as I mentioned, the Moderna vaccine was approved last week, and so that's just starting to become available now. The key question is the AstraZeneca vaccine that has been authorized in the UK, but for reasons that are not really clear, the company didn't actually request EU authorization until 3 days ago. So the European Medicines Agency is saying they're hoping to approve that on January 29th. That vaccine is a lot easier to store than the Pfizer vaccine. That's been part of the distribution problems that national governments have been having in Europe, is that it requires such extremely cold temperatures to transport and store. The good thing about the AstraZeneca vaccine is it doesn't require those temperatures, and you only need one. There are other vaccines also. The Johnson & Johnson vaccine, for instance, seems very promising. The EU Commission has pre-ordered over 2 billion doses across 6 different vaccines. So the EMA, I think, with this news from Pfizer, is going to be under increased pressure to really get those further approvals going so that the EU isn't relying on just one vaccine from one production facility, because we can see what happens when that is the case. Now, also Pfizer's partner in this, BioNTech, they're trying to get a facility up and running in Germany that can also produce vaccines. They're hoping to get that online very quickly, and maybe that could overcome the drop in availability in February. Everyone's just kind of nervously waiting to see what effect this production chain change is going to happen in the vaccination campaign.
All right, David, nervous wait indeed for many, as you've explained there. Keeping us up to date with that delay in deliveries on Pfizer vaccines. Thank you, Dave.